Morning, everybody. We have 25 Rotarians in attendance today. We have 3 guests. One is our speaker, which will be introduced in a little bit. Taylor also has a guest want to introduce.
Yes, this is my boyfriend, Mac.
And then Jan also has a guest.
I brought Mark Young with us today. Mark has sold almost everybody here clothes. I thought he was going to be able to do some business here, but he's selling Chip and I clothes for a long, long time. The Colonel Sanders suit is not his fault. I think that line.
We also have Claudia.
Hi.
Rick Martin, do we have any birthdays?
I'm not trying to get food over here.
We're waiting for you. That's okay, we'll,
I'm already.
okay.
I'm over here. Did you hear me okay? Okay, birthdays today, club anniversaries. Is John not secure today? No.
He had too much money, 505.
Okay. Nothing like. Yeah.
Tom's on Zoom, he's on vacation.
Oh, he is. Right, okay. Well, Tom's got a club anniversary and John also on the 15th, both of them got 7 years with the club. And we have some wedding anniversaries. Rusty here. All right, well, Rusty Hoffman and Steve Wertz both have wedding anniversaries. Steve on the 12th and Rusty on the 14th. So you see those guys, 37 and 38 years respectively. Give them congratulations. And let's see, we have member birthdays. Let's see, we have Mr. Dale Farlow. I know you're here today. Happy birthday, Dale. Kelly Farrell and Ross Geller here. Ross. And let's see, Mr. James Kennedy here with us today. There he is. I think you have a birthday. What is your birthday? Buddy Jim. So let's all join in and give him a good happy birthday song. Happy birthday to you. Happy birthday to you. Happy birthday, dear me. Happy birthday.
We having happy dollars?
Do we?
I don't know. Steve has his hands up.
Yeah, I got happy dollar. Many thanks to Danielle and my Ethan for continuing the 505 tradition. She put on quite a show last night. I mean, the 505 was quite a show that she put on last night.
Don't be charging the environment, Steve.
Anyway, kudos to
Yay, Danielle!
I feel like it's time for a quick little update on Rotary and Victoria. Rosa's off to NC State. She went a week early to, she's living at the Delta Gamma House. So they are work week. She said it really is 9 to 5. Yes, it's a work week. So she's enjoying that. She did get into an internship program with our state magazine. Only 2 women made it, her and a senior at Harvard. So she was very proud of herself about that. So I can't wait to see how that turns out for her. And then Victoria, of course, is getting ready to start senior pay. So 1 more year left. Oh, God.
Exciting.
Yes, exciting stuff.
Yeah. Well, Wilder's CEO is the.
Not quite yet.
His boss gave him a big project to work on, and it's an add-on to another project.
whole thing after reading the contract one time. And so like, he's completed his project in about an hour and a half, but he got given 3 days to work on. So if this clause is in here, we're not interested, right? The boss is, yeah, thank you very much. The other son took a new job, they started the same day, August the 8th of 9th, I think it was. And anyway, or no, last month, what it was. And he's already had lunch and played golf with the boss, and he's been very with this. All is well with him.
Continue to report on children. Today is our family anniversary. Katie Quinn.
I'm on the Zoom Rotary meeting.
Years ago
And I-
today. So we celebrate that, and we get to celebrate extra because at the moment, we're allowed to go to Scotland to see her for the first time.
You're tough. I tried. Not bringing me a couple.
Major story.
Hey, man, I'm pretty happy today. We got Big Scott coming up. We're just sending the first notices out. The other teams get responses back. So it's not too early to be thinking about that. And big fundraiser and a lot of fun out there. So keep that on the back burner. I've got an order in for perfect weather for Big Scott, and I'm sure they'll be honored. So get that down and calendar, get ready.
Dan, are you gonna pay us all?
Let me see.
Yeah.
No, don't worry about that.
20 will be better. Yeah. Yeah. Any further action? I didn't know.
And on that note, I think Guy and Matthew are putting together a cook team for Gate City, so if you're looking out to see Guy or Matthew.
This was a fishing conversation Matthew and I had, so it's gonna happen.
So we have.
And I'm trying to recruit some professional folks to join your team.
Well, Grant had some talk and he said, you know, he did just think about how dumb the average person is. And then just realized that half the people are dumber than that.
Okay, I think Danielle had an announcement.
Just some quick reminders for the vacation schedule. Matthew, if you can hear me, you're August 19th. Ross is here, 22nd. Brad, you're September 2nd. And then Jake Gray, is 9th. So for the folks that are here, I'll push out a reminder. Thanks to Steve for the happy hour 505. It was a really fun crowd last night. We were at Craft City Tiffin. So I think this next Thursday, we're gonna switch it up and go to Grandover. So if you guys are interested, Grandover, coming Wednesday, come out, bring friends, bring family members, very casual. That's about it for now.
How many people were there last night? It was a big group.
It was, I think it was 20-ish or so. You know, we had one prospect, which was Rick Crow. He came and talked to the club a couple weeks ago.
We had
Two prospects, okay? Good mix of people between the Sunset Club and our club, and there are a couple of other members come through. So yeah, I hope we continue gaining traction.
Danielle. Taylor's our youth services chair, so she has an announcement.
Good morning, everybody. I hope that you are as excited about Friday as I am. I have a strong suspicion this will not be my last cup of coffee today. We are still in the midst of our supply drive, which is ending next week. So next meeting, Charlotte has some receipts for those of you who have already donated. So we'll be getting in touch with y'all to get you those receipts. But if you haven't donated and time is an issue, we are taking cash and Venmo donations. So if you have a question about that, shoot me an email or send me a text. I'm happy to help you out on that. We also are happy to come pick up any supplies if a business is doing a donation. Yes.
I have a question that, the Venmo thing you just put, I did a Venmo donation. I didn't really find out if anybody received it or not. So I'm just kind of curious, you just put what asked, who does our Venmo account to get you directly?
Dale Farlow.
Yes, yes, and if you would put supply drive just in the memo or something to that effect, we'll know, and then we'll be issuing you a receipt. So Charlotte's working on that.
Yeah, I'm not worried about the receipt. I just want to make sure somebody's
Yes.
monitoring that Venmo account for
Yes.
where it goes. You know, we have $50, we have other things. I don't know what kind of donations you can make.
Well, Tom, you sent us an email when we got Venmo donations, so we see when they're coming in. And on the day after the drive, in that time period, I'll be sort of taking inventory of how much we've got in there and going and getting the supplies. But we really appreciate all your support as y'all. Yes, Chip.
Do we have a specific goal? How are we doing against that goal?
So we do not have a specific goal for this particular drive. Since it was kind of a last minute thing and a conversation I had with the principal, we were just throwing it out to the club and seeing, you know, what we could drum up before the school year started. But hey, so the more the merrier. So if you haven't donated, we would really appreciate you doing so. As y'all know, these kids are coming out of being in a remote learning environment and so haven't really needed school supplies in that kind of way. And with parents and the community trying to recover from the pandemic, every little bit helps. So again, really appreciate your support. Age high school. So, all right, y'all, thank you.
Thank you. We're excited about this. A couple of other announcements. Our district governor, Chris Justice, is visiting the Satellite Club this coming Monday evening. So it would be great if we could have some other Lake City Breakfast Club members to participate. Or come Monday and we meet at, or they meet at Cafe Pasta at 5:30. So be there. It'll be nice. Children of Vietnam golf tournament,
Yeah.
September 10th.
Yep, September 10th.
What happened?
Great, great. And then the district golf tournament is October 14th, and I think they're still recruiting for that. So it'd be great to have a team from this club. I think Tanya and I are trying to get a team together, so we'll see how that goes. One thing I would like to do, because this year we're trying to get back to the basics of Rotary and networking, business networking. So starting next week, this will be a little different than a member talk, but I would like to have one member in our club to highlight, give them 2 to 5 minutes to just talk about what they do in their profession. And so next week, we already have someone. So if you're interested in speaking 5 minutes, just let me know and I'll get you on the schedule. Anything else? Anybody have anything else? So I, at this time, I would like to invite Claudia Kennedy to come up. We have some special.
Thank you, Lisa. Yes, there are a number of things we want to talk about with respect to all the good work that our Rotary Foundation does.
Morning, Ann.
You may or may not know this, but the impact that our district, our 47 clubs and 2,400 members has in our community and around the world is significant, substantial, mind-blowing. Bottom line is our district has close to $1 million of impact, not only at home, but around the world. And I'll explain what those are. We currently have in process 11 global grants. That's about $570,000 that our impact is having for the global grants that either we have originated or accepted or are participating in with other districts. The countries that we're involved in right now: Uganda, India, Philippines, Mexico, Sri Lanka, Haiti, Guatemala, Honduras, Moldova, We have a global scholar who just recently went to Bologna, Italy to study peace and conflict resolution that our district is sponsoring for a 2-year program. We are in the process, we've also recommended and proposed a peace scholar, but we won't know whether that person, only 6% of applicants are accepted as peace fellows. But our candidate will find out in October, I believe, or November, whether or not he has been accepted, but we're hoping that he will. But all of the things that we do, whether they're at home or abroad, are in the 7 areas of focus. You know what they are: clean water, economic development, disease treatment and prevention, peace and conflict resolution, saving mothers and children, literacy, and protecting the environment. Now, our district grants, the 65 district grants that we finished for last year, have an impact of about $300,000 just in our district. And then the impact of what clubs have done individually without the help of that district grant funding, that's about another $125,000. So we are at $1 million in terms of what we did just last year in the impact our foundation has. Why does that happen? Because of the contributions and the support that our members give to the Rotary Foundation. Last year, the annual fund raised about $438,000. Polio Plus was $106,000, but with the 2-to-1 Gates match, that's about $300,000. And I hope you all know that this year we've had 2 cases of polio. 1 in Afghanistan, 1 in Pakistan. We had those 2 cases in January, and there have been none since. If we close out this year with 2 cases of polio, we believe and project that we will be globally eradicated. Polio will be globally eradicated by 23 and certified polio-free by 2026. That's an accomplishment. Now, in terms of Gate City Club, here's some interesting facts. This club has 80 Paul Harris Fellows, 57 benefactors, 11 Bequest Society members, 6 major donors, and your all-time giving is $477,000. This club. All the good work we're doing around the world. And it's that good work and that financial support. You know, we say give your resources and your talent, but it's your time, your effort, your dedication, and quite frankly, your money. We need it all. So in terms of, so let's honor some folks who have achieved this honorable distinction. So we'd like to award Brad Guile his Paul Harris Fellow Award. Is Brad here? There you are, Brad. Thank you so much. Now, let's see. Boycott, are you here? You are a Paul Harris +2. Are you here? There he is. Now, I know Kelly's not here because I haven't seen him, but Kelly here is Paul Harris Fellow +3, and we will get his two-person Paul Harris Fellow +6. Thank you. Buster Lewis, Paul Harris Fellow +6. Thank you. Now, Bobby, I know you're on vacation, but you're Paul Harris Fellow +7. Thank you, Bobby Christensen. I'm sorry. I know you're here. I know that. I was confusing you with Tom Richardson. I'm sorry.
Because I'm wearing
And you don't even
flip-flops.
look alike. Oh, here is fellow.
You're always on vacation, just admit it.
Now, I wanted to mention that the major donors. Now, major donors are individuals who have contributed $10,000 to the Rotary Foundation. This club has 6. Mike Conrad became a major donor in August of 2013. Rusty Hoffman became a major donor in December of 2009. Chuck Langdon became a major donor in June of 2002. Dan Quinn, January of 2019. Tom Richardson, sorry, Tom, I know you, stop by. Tom Richardson became a major donor in November of 2018. Now, there is a person in this room who became a major donor in April of this year. So Dr. Guy Rabondo, would you please come forward? This is a nice award. Guy and Carrie are major donors. The Rotary Foundation, they have an engraved crystal that you can probably display in your office or in your home. In addition,
Put a pin on it and wear it.
in addition, we have a major donor pin and a major donor pendant that Carrie can wear if she would like to wear. So thank you so much for your service, for your support, everything you've done for the foundation, and all of the packaging. There's more packaging.
Yeah, thank you.
Thank you.
So thank you, everybody.
At this time, I'll invite Jim to introduce our speaker.
Morning, everybody. We're very pleased today that we're here from one of my very favorite nonprofits. As I was telling Christy, our guest speaker this morning, just like we have food deserts in Greensboro, we also have healthcare deserts. And today we're going to hear from Christy Collum about mustard seed community health. Christy is the director of development at Mustard Seed. She has a very long and distinguished career in nonprofits. She's been giving officer at Make-A-Wish. She's been director of development for one of my other favorite nonprofits, Reading Connections. And she's been also associated with the Special Olympics. So please give a warm welcome to Christy Collum.
Really loud speaker, so I'm going to start by just throwing a couple of these on the table so that it pretty much tells you a lot about mustard seed. And for those who like to look at things while you're listening to me. So I am Christy Collum, and I started with Mustard Seed in January. I retired from Make-A-Wish at the end of 2020. And so I am semi-retired because I work part-time for Mustard Seed. And I cannot tell you what an amazing organization Mustard Seed is and what a gift it is to the community. Give me a show of hands if you've heard of Mustard Seed. Okay, so that's about it, about 10% of every room. So it is Greensboro's only free and charitable clinic. And so what we mean by that is whether you have insurance or not, you can come to Mustard Seed. We serve those who are at 200% of the poverty level, and we use integrated healthcare. So what I mean by that is all the social determinants of health, just like you guys have your pillars. Many of those pillars are actually the same social determinants of health. So as Jim was saying, food desert, yep, Mustard Seed's in a food desert. That's why we have cottage gardens, we call them. So it's raised beds that members of the community come out and take care of, and then the community members themselves come and pick it whenever it's ready. So we address the food shortage. We also collect canned foods, stable, shelf stable stuff to give out. And we have a local farm that contributes fresh fruits and vegetables. And the Jewish Federation also gives us fresh fruits and vegetables. How we get those to our folks in the community is by our team that we call the Health Outreach Team. So we have several ladies. During COVID, we actually were able to bring on board several different cultures because, Greensboro is, I think we have like 137 different cultures. Many of those cultures come to the clinic because we have interpreters, we have a longstanding, 5 years longstanding, because that's how long we've been around, partnership with a lot of those communities so they can feel comfortable coming to us, which was a great boon in getting people vaccinated. Because a lot of these cultures do have trust issues, but we've been able to do a lot of vaccinating within those cultures. So the HOT team members go out into the community. They check on our older people because there's a lot of older people in the community as well. We check on patients who have longstanding illnesses like diabetes, making sure that they're getting what they need. So the HOT team members distribute the food as well as check in on the community members and then bring that report back to us. And if someone is in need, we try to help them with that, whether that's a housing issue, whether that's a food issue, whether that's a physical health issue, or whether that's a mental health issue. And speaking of mental health, I bet you if I asked you to raise your hand as to whether you think the pandemic affected the mental health of anyone you know, every hand would be raised because it has affected us greatly. What we have seen is that it has hugely, disproportionately affected those in our community who do not have the resources that most of us in this room have. So we, in order to address that issue, we are teeny tiny. Have any of you actually been to Mustard Seed Clinic? It's literally like 800 square feet. It's one of those really tiny little houses. We're desperate for more space because we can't treat more people without more space. So we hope to address that within the next few years. But the mental health is at such a crisis in the community that we are raising money right now to rent a townhouse, which is next door to one of the townhomes that's next door to the clinic, for a mental health space, especially for children in the community. So we partnered with UNCG to be able to have some of their master's level licensed clinical social worker students to be able to come in. We have a licensed clinical social worker on staff. So we hope starting September 1 to be in that space and to be doing more mental health care than we're currently doing. We expect to probably be able to serve several hundred a year just doing that. So if you got some money and you want to put it somewhere, that mental health space would be a great use of your money for the community. Otherwise, I guess some stats on us. As I mentioned, we've been around for 5 years. We serve around 700 patients a year. Appointment-wise, we're probably around 2,500 appointments a year. Ways that you guys can help individually or as a club, of course, as she said, we always want your money because it takes money to have things work. But we also have like I said, the food. We have reading. So we have many of the children who come in, we keep like a big stack of books for kids. And so we're always accepting books for school-age children. Other ways you can help are when we do have events. We have 2 events a year. One is more toward corporate giving, and it's our Sowing Seeds Rodeo that we have in the spring. Think a food truck community festival kind of thing. We had our first one of those this year. Super fun. We were on pins and needles because when we made the decision to have it in January, we were like, no, is the world still going to be closed? I don't know, but we're going to go forward And fortunately, it opened up like 2 weeks before we had it. So that was really fun. And then we have our luncheon on October 21st, right here in this room. So if any of you are interested in hearing more about mustard seed, touch base with me. I have some cards that you can take, and I can give you information about that luncheon. It's our largest fundraiser of the year, just like many nonprofits. But that's a little bit about mustard seed. So I'm happy to take any questions, either from the podium or individually after. Anybody got any questions from the podium? Jim, thank you.
Memory serves, I think you set up a COVID-19 vaccination clinic, you know?
We did, thank you. And now we're also doing children 12 and above. So we do the Moderna for adults and the Pfizer for children. And every Monday, someone does not have to be a patient. You can just call and get an appointment. Mondays are when we do that because you know the shelf life on those vaccines is very short. So only on Mondays are we doing those. But yes, we are, and you do not need to be a patient to receive one. Got it?
You said you guys are 1,000 square feet roughly. How big a space would you want?
Well, ideally, we would love to also have dental care. Next time, optical care, because as you can imagine, like especially when so many of our patients are diabetic, and so we would like to have optical care. So ideally, we would like to have a space large enough to accommodate like 3 mental health rooms, a dental clinic. And that closed down many years ago, before the tornado struck, actually. And I just met with the owner of that building. He's a local architect, and just started discussions with him about possibly renting that space from him starting at the end of 2022. So, yes. Wait, I know your name. Steve.
That's scary.
I know, right? It just happens the 3 people in the room whose name I know, you guys are raised your hand.
Describe the dynamics of a typical day there, like what's going on?
Oh my gosh, that's a great question. And much like many of your jobs, it changes daily. I mean, there's the nucleus, but Dr. Mulberry will do house calls. So think of like all the elderly people in our community, the food desert, the transportation desert, etc. So Dr. Mulberry actually does go into people's homes. So any given day could look like she could get to the office. We do have a teeny tiny lab. We have one lab tech, and so we have a teeny tiny little lab. So someone could be coming in right now. We're doing some back to school visits for kids, you know, like a well check for sports. Hopefully they happen this year. And it could be her going out to someone's home. The hot team members come in and meet on Thursdays, and they come in every day to pick up food to go out into the community and distribute it. So pretty much anything you could think of that involves social work, including medical, mental health.
Are you involved at all with United Way of Greater Greensboro and the Family Success Centers and hopefully a funding partner?
That's a fantastic question. And the answer is not really. Honestly, most of our funding comes from individuals. They hired me in January because I am a professional fundraiser. This is what I've done my whole life. And we don't even have an executive director. So we are really lean. Our budget is like 400,000. So we're definitely in that phase where we need to grow to be able to serve the community more. So to specifically answer your question, no, but we are a member of the Free and Charitable Clinics Association of America.
Are most of your medical professionals volunteers or?
Another great question. So on staff, we do not currently have medical volunteers except to fill in. Our goal, of course, is to have medical volunteers once we have the space to do the dental and, and optical, and several of the free and charitable clinics do operate in that manner, that they only staff volunteers. But we also feel like in the community in which we're serving, they already have a level of distrust. So it's very disconcerting for them to come in and not know the person. So we try to keep, Dr. Mulberry, our medical director, we try to keep that stability. So we want to eventually have volunteers in other areas, but as far as for like primary healthcare, we would eventually like to have one other doctor and Dr. Mulberry and have them on staff. So there's that consistency for the community. Yes.
What is there entity that like Triad Health?
There used to be
Is that a-
Health Serve,
Okay.
and then there is a free and charitable clinic in High Point. And there's a free and charitable clinic like Rockingham County, Winston-Salem has one. But we're the only free and charitable clinic in Greensboro.
So that Health Serve is not.
It's no longer viable.
Oh.
I did read in Sunday's paper that Dr. Patrick Wright is trying to start another one. So there may be, I mean, there's certainly room for more, but the key determinant in that is it needs to be in the community in which it's serving. So I could definitely see another one down, Old High Point, Martin Luther King Boulevard. Sorry, old person here. I still call the roads the old names. So there are definitely other parts of Greensboro.
Well, what happened to them? They shut the door?
I don't know the full story on that, but
Not there anyway.
right, yeah.
Christy, are most of these folks getting vaccinated or are they resistant to the vaccine?
We've actually been really happy with especially the different cultures who have trusted us enough to come in and get that vaccine. And that goes back to those hot team members going out and knowing the community. We have a really large Asian population, Hispanic population. And so our health team workers, many of them speak numerous languages because they're from the cultures. And so they have been able to go out and explain to people, help people when everything was such chaos, to help them understand. So yes, they've really been able to help with that. I mean, it's always a personal decision at the end of the day, but we feel pretty good about the numbers that we vaccinated. Okay, well, I'll be around afterwards with my business cards and to answer any other questions.
One more, where'd the name mustard seed come from?
It's from the Bible. There's a verse in the Bible that says, if you have the faith of a grain of a mustard seed, then you can move mountains, i.e. our movers of mountain luncheon in October. So yeah, so that it was originally started by Beth Mulberry, one other gentleman, and then a local UCC church. So, and we do still have a lot of churches who send us people and some who also contribute. I hear I'm supposed to. I'm not sure what I'm supposed to do.
My chances are.
Oh, read the numbers. See, drawing wasn't a problem, but someone at that back table is going to probably have to help me read it. Let's see, 507, 806. 507, 806. Yeah, get out. See, it's your day. I get to really pick on you today, guys. Yeah, it is.
Where's the card?
Thank y'all for having me.
This pot is growing, it's over $1,000. So buy your tickets next week.
Have a great day.